My name's Dr. Renee Pozza. I serve as a nurse practitioner in hepatology. I've worked in hepatology for over 25 years. Thank you for listening to some common questions that those of us that are APPs in hepatology receive from primary care or from new nurse practitioners that are working in the GI or hepatology space. So I think probably one of the most common questions I get is, if I'm a nurse practitioner or PA and I'm working in primary care or even in GI, and I identify a patient that I think has the risk factors for fatty liver disease, or what we call MASLD, a metabolic-associated steatotic liver disease, or even MASH, which is metabolic-associated steatohepatitis, what are the workup that I should be doing, and who should I refer to hepatology? So let me give you a quick answer to that question. The workup is really looking at the individual holistically. Certainly, history and physical are important parameters to look at, but you can also consider then what non-invasive testing can you do within your setting. And every setting will be different, but you might have access to things called a FIB-4, which is a fibrosis assessment marker. It combines age, platelets, AST, and ALT values. If you have access to an electronic health record, you may be able to use this as a point of care testing, because your electronic health record may be able to calculate that for you, or you certainly could order it on a lab test. And that score will give you a pretty reliable assessment for individuals within the age of 35 to 65 to see if they have any risk for advanced fibrosis or showing signs of advanced fibrosis. I think the other thing that you might have access to would be a FibroScan. This is a transient elastography test that requires someone that has some skill in doing it and some training in doing these assessments, but it will give you 2 scores, which are important for assessment of fibrosis in that patient, as well as the amount of fat that is in the liver or steatosis in the liver. So the CAP score certainly gives you how much steatosis are you seeing in this liver, as well as the kilopascal score for a FibroScan gives you assessment of fibrosis. So, I think anything that you can do within your practice around non-invasive testing to help you get some assessment of fibrosis is important in these patients, so that we can identify our MASH patients early and offer treatment options for them. So probably my second most common question that I get from primary care APPs is, what lifestyle modification should I recommend for my patients with MASLD or MASH? And I would say certainly anything that we can do around metabolic, maximizing the treatment of metabolic disease. So assessing risk in these individuals for cardiac issues, how are they on their diabetes? Are they pre-diabetic? Are they in the diabetic parameters? And then how are you managing that so their sugars are well controlled? Then other lifestyle modifications that I would recommend are certainly related to weight management. And so obesity management. So are they overweight, obesity? And some of this then is coaching and lifestyle modifications around nutrition and exercise and trying to maximize the patient's ability to lose weight. And we know that's difficult and really takes a team. And so some of you might have access to nutritionists. Some of you might have access to exercise programs that you can do. Some of you are going to have to do it yourself as you're motivating and coaching these individuals into healthy lifestyles. So those were just my 2 little tips on some commonly questions that I get in a hepatology APP practice. So thank you for listening. And for more information, I refer you to GAP and the MASH Community Network and all of the resources that are available through this.